USMLE style question, non-ST segment elevation myocardial infarction, NSTEMI, and subendocardial infarcts. A 60-year-old woman with a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus presents to the emergency department with chest discomfort that started 3 hours ago. The pain is substernal, non-radiating, and associated with diaphoresis and shortness of breath. She denies nausea or vomiting. Her blood pressure is 150/90 mmHg, and her heart rate is 88 BPM. An ECG shows nonspecific ST and T wave changes without ST segment elevation. Troponin 1 is elevated, confirming myocardial injury. Which of the following best describes the most likely location of infarction in this patient? A. Full-thickness myocardial infarction. B. Subendocardial infarction. C. Left ventricular outflow tract. D. Right ventricular infarction. E. Posterior wall of the left ventricle. Answer: B. Subendocardial infarction. Explanation: this patient is presenting with non-ST segment elevation myocardial infarction, a type of acute coronary syndrome ACS in which there is elevated troponin but no ST segment elevation on the ECG. In NSTEMI, the infarction is typically subendocardial, meaning that it primarily affects the inner layer of the heart muscle, the subendocardium, which is the area most vulnerable to ischemia due to its location at the end of the coronary arterial tree. Pathophysiology of NSTEMI and subendocardial infarction. NSTEMI occurs when there is partial occlusion of a coronary artery due to the formation of a thrombus on an atherosclerotic plaque. The thrombus does not completely occlude the vessel, allowing for some blood flow to the myocardium. The subendocardial layer is most affected because it is the most distal part of the myocardium, receiving blood from the smallest vessels. As a result, it is most susceptible to ischemia and injury during episodes of partial coronary occlusion. NSTEMI typically results in a non-transmural infarction, meaning it affects only the inner layers of the myocardium, the subendocardium, unlike STEMI, which is usually transmural and affects the entire thickness of the myocardium. Why the other answers are incorrect? A. Full-thickness myocardial infarction. This is more characteristic of ST segment elevation myocardial infarction, STEMI, where there is complete occlusion of a coronary artery, leading to transmural infarction, affecting all layers of the heart wall. C. Left ventricular outflow tract. This refers to the region of the left ventricle that leads to the aortic valve. Infarction here would not be typical of NSTEMI and is not a common location for subendocardial infarction. D. Right ventricular infarction. Right ventricular infarction usually results from occlusion of the right coronary artery and typically presents with elevated right-sided heart pressures. But this is not consistent with NSTEMI or subendocardial infarction. E. Posterior wall of the left ventricle. While the posterior wall can be affected in myocardial infarction, this location is not specifically characteristic of subendocardial infarction in NSTEMI. The posterior wall infarct would typically be transmural in STEMI. Key takeaways: NSTEMI is characterized by elevated troponin and nonspecific ECG changes, with subendocardial infarction as the most common infarction pattern. Subendocardial infarction affects the inner layer of the myocardium, which is most vulnerable to ischemia due to its distal location relative to the coronary vessels. STEMI involves complete coronary artery occlusion and causes transmural infarction, whereas NSTEMI involves partial occlusion and leads to subendocardial infarction. Risk factors for NSTEMI include hypertension, hyperlipidemia, diabetes, and smoking.